Welcome back, and this is Dan GH, and my name is Anita. Today we are going to talk about the heart. If you watch my previous video, I did talk about the newborn examination and the eyes, and I also did explain that newborn examination is a systematic examination of the newborn. Then the examiner asks you to focus on one of the four parts, which is the eyes, the heart, the hips, and the testes. We've already talked about the eyes. Today we are going to focus on the heart. This video is going to be super short because this time I'm not going to talk about the whole systematic examination of the newborn, but we're just going to talk about the information you need to give your patient when you are talking about the heart. As you communicate with the patient, the examiner also listens to it, so it's more like a win-win situation. You are not supposed to look at the examiner and pretend the examiner, so this is examination is done. No, you need to communicate with the patient, which is a dummy. And as you communicate to the patient, the examiner will be watching you and will mark accordingly. Welcome back. So with the heart, there are four things always keep in mind, and that is what the examination of the heart is about, when the examination is done, how is the examination carried out, what if there is a positive screening test, what do you do, and what if there is a negative screening test, what do you do? So talking about the heart, what is the examination about? So the examination is to refer and identify all babies born with congenital abnormalities of the heart, and this examination is to reduce morbidity and mortality. Asking yourself, what are some of the congenital abnormalities? That could be dactylsarcoidosis or tetralogy of Fallot. Let's talk about when the examination is done. The examination is done twice, which is first 72 hours of baby's live birth and repeated 6 to 8 weeks by the GP. How is the examination carried? Now the examination is carried out with a stethoscope as shown on your screen. You will be auscultating 5 areas of the chest, and that is the mitral area, pulmonary area, aortic area, tricuspid area, and the bicuspid area. So those are the 5 areas you'll be auscultating around the heart. As shown on my screen, I did a bit of a diagram of where you'll be placing your stethoscope. While the examination is going to be done, you need to talk about what you are looking out for when you are doing the examination. There are 7 things I always have in mind that helps me and guide me, and the first one is going to talk about, I'm looking out for nasal flaring. I'm also looking out for apnea lasting more than 20 seconds. I'm looking out for tachypnea. I'm looking out for visible pulsation. I'm looking out for central cyanosis. I'm looking out for murmurs or extra heart sounds. I hope this makes sense. And the last one is intercostal recession or chest recession. These are the 7 most important things you need to look out for to help with or guide your communication when you are talking about the heart. Now, when we ask you, before the examiner is going to tell you, or because you probably might be auscultating a mannequin, how are you going to hear, or how are you going to hear if there are any murmurs or extra sounds when you are locating at the mitral, pulmonary, aortic, bicuspid, and the tricuspid area? You wouldn't hear anything. So how is the examiner going to report, or the examiner going to give you feedback if it's normal or abnormal? That means that you need to explain where you are placing your stethoscope. I hope that makes sense. So as showing on your screen, where do we identify the mitral area? So the mitral area is the mid-clavicular space. If you say the mid-clavicular space, you've already talked about where the mitral area is, and it's enough for the examiner to give you the results if it's normal or there are murmurs. The pulmonary area, if you are looking on your screen, is the intercostal space towards the left sternum. The aortic area is the intercostal space towards the right sternum. Then you come down to the tricuspid area. The tricuspid area is the lower left sternal border, and the bicuspid area is the lower right sternal border. If you are to talk about where all these are, this is enough to score you, and this is enough to pass you when you are asked to focus on the heart. So, examiner, I'm going to examine my baby's heart. I'm going to auscultate the 5 areas to listen out for murmurs, extra sounds. I will also be doing a visual examination of the nose to check out for nasal flaring. I'll be checking the chest for intercostal recession and central cyanosis. I will also be looking out for visible pulsation and also tachypnea and apnea. So as I start, Helen, I hope that is okay with you. Is it okay for me to expose your baby's chest? As I start, you might realize that I might be a bit quiet. Don't worry, it's just because I'm trying to listen for if there is any additional heart sounds. So do not be so worried about it if I'm quiet for a while. Hope that is okay with you. So I'm placing my stethoscope on the mitral area, which is located at the mid-clavicular space. Then probably the examiner will tell you, examiner, can you confirm with me since it is a dummy if there are no murmurs or heart sounds? All normal? Then you move on to the next. I'm placing my stethoscope at the pulmonary area, and this is the intercostal space towards the left sternum. I'm now moving on to the aortic area, and I located this at the intercostal space towards the right sternum. I bring it down to the tricuspid area, and that is the lower left sternal border. Then I move it to the bicuspid area, which is the lower right sternal border. How beautiful is this? And this is enough to mark you. We've talked about how. Now let's move on to what if. What if there is a positive screening test? You will need to do an emergency 24-hour referral, because babies with congenital abnormalities of the heart can stop breathing at any point, or will be having difficulty in breathing, or will be showing central cyanosis. This is an emergency, and this can affect baby. You can lose baby at any point. So anytime you identify abnormalities of the heart, you need to do an emergency 24 hours referral to the senior pediatrician with in-depth knowledge in cardiology. If there is a negative screening test, good. Then you have to wait 6 to 8 hours and have the examination repeated by the GP. I hope this video has been super helpful. It's very simple yet very detailed. I know some will be like, oh my god, am I supposed to keep all these things in mind? It's going to be hard. One will be wondering, oh my god, this is so detailed. How am I going to identify areas of the heart? So as I know, you can just be talking to yourself. So there are 5 areas of the heart. We have the mitral area, we have the pulmonary area, we have the aortic area, we have the tricuspid area, we have the bicuspid area. I'm looking out for 7 things. I'm looking out for tachypnea, apnea, visible pulsation, central cyanosis, intercostal recession, murmurs, or heart sounds. Yes, just be talking to yourself. Just make sure that at any point you can remember it. Where can I find the mitral area? It is identified at the mid-clavicular space. Where can I find the pulmonary area? It is the intercostal space towards the left sternum. Where can I find the aortic area? Intercostal space towards the right sternum. Where can I find the tricuspid area? The lower left sternal border. Where can I find the bicuspid area? The lower left the lower right sternal border, and just be talking to yourself, and I hope you come out successful. Please do share my videos as usual. If this video has been super helpful, as usual, like, subscribe, share to your friends, have a group chat, discuss the video, what in the video is entailed, learn more, and bye.